The Canvas trial involved canagliflozin, another SGLT2 inhibitor. And in the Canvas trial, patients were randomized to placebo or canagliflozin in a cardiovascular outcome study, and then also randomized to canagliflozin or placebo in a renal outcome study. And the two studies were merged to look at cardiovascular outcomes. One thing that's different from this trial, with this trial from the other trials, is that there was an interim unblinding of the Canvas trial itself, which was used to support the cardiovascular safety of canagliflozin before marketing. And then events were accumulated, and the final study was released in June of 2017. And in the Canvas trial, for the primary endpoint, which was the first occurrence of heart attack, stroke, or cardiovascular death, there was, again, a 14% reduction in the cardiovascular outcome, which was highly statistically significant for non-inferiority and statistically significant for superiority. There were trends towards benefits on the other sub-analyses, so cardiovascular death, heart attacks, strokes, and total mortality, and as well as a statistically significant reduction in kidney endpoints, specifically albuminuria. The Canvas trial really looks very much like the EMPA-REG trial with regards to the types of benefits that are seen. One thing that seems apparent is that the relative reduction of each of the components of the composite endpoint in the Canvas trial are more similar. In the EMPA-REG trial, there was greater differences with dramatic reductions in death, and in EMPA-REG, no benefit on stroke. And here there's more consistency with the Canvas trial. The one surprise in the Canvas trial was really around amputations. So there was demonstrated statistically significant approximate doubling in the risk of amputations seen with canagliflozin in the Canvas trial. This was evident in both parts of the trial, in the Canvas cardiovascular trial and in the Canvas renal trial. Most of these amputations were so-called minor amputations, toes or less than toes, and the minority were legs, below the knee or above the knee amputations.